Hi, my name is Jamie Zink, and I am a physician assistant at Essentia Health. I have been asked to do a presentation on what a physician assistant is, how to become a physician assistant, and things that you can do to prepare for yourself in high school to pursue a career as being a physician assistant. I normally do this talk in person, but obviously due to the times I've been asked to do this as a PowerPoint video, and this is my first attempt at this, so we'll see how good it goes. So first of all, what is a physician assistant? A physician assistant is a medical provider who is an expert in general medicine, kind of like a physician in family practice. We are educated along the same type of model. We are able to diagnose, treat, and prescribe medications. And many physician assistants work in primary care. However, it's becoming more and more popular and more of a demand that physician assistants work in specialty departments. PAs or physician assistants go through a pretty vigorous training. However, the education time is shorter than a physician, and a lot of our learning is done hands-on through mentors and rotations and things like that. It's been known and studied over time that patients really enjoy their physician assistants and they are trusted with their health care. It has been surveyed and 93% of people regard their PA as a trusted healthcare provider. It also takes the burden off of our current healthcare system, which struggles to keep and hire enough physicians. And we are able to fill some of those roles to help with the concerns with not having enough healthcare providers for the population. Sorry, it looks like I had difficulty with moving the screen forwards, so hopefully this will work. The history of the physician assistant profession. It was created in the mid-1960s by Eugene A. Steed Jr., who is a MD at Duke University Medical Center. He had put together the first class in 1965, and he had used the military service as his model for the program. The first PA class graduated from Duke University October 6th of 1967, and now traditionally October 6th week every year is a celebration and called Physician Assistant Week. In August of 2019, the North Dakota legislation passed a law that, like physicians and nurse practitioners, physician assistants don't need supervisory contracts any longer. This is a benefit because it did restrict PAs from being hired in rural communities that do not have direct access to a physician. The importance of physician assistants. I've kind of touched on this a little bit already, but we are really vital to the healthcare system. The Affordable Care Act was enacted in 2010, and it did recognize physician assistants as one of the three primary care providers: physicians, physician assistants, and nurse practitioners. It also empowered PAs to lead a patient-centered medical team, and that is what we were trained to do. The demand for physician assistants is very high. 3/4 of PAs receive multiple job offers following graduation, passing their licensure and certification exams. Studies show that the most financially successful hospitals use PAs to their maximum abilities. The demand for physician assistants has increased over 300% from 2011 to 2014. I don't have any more current studies to show you, but there are currently 131,800 PAs practicing in the United States, and we treat over 4 million patients every year. This is a really neat slide because I think it adequately describes how important and how amazing a job as a physician assistant is. We were voted the number 3rd best job by US News and World Report in 2019. We were voted number 1 for best healthcare job by the same report in 2019. In 2018 in Forbes, we were the number 7th highest paying job in America. And in the Bureau of Labor Statistics, we were the 5th fastest growing job in America in 2019. I feel like that just shows how important physician assistants are and how much we are growing as the need is there for us. So what can a physician assistant do? If you're interested in becoming a PA, what kind of things are you able to do? A lot of you have been to a provider in a office setting before, and even some of you may be in the hospital, but we can come in, we can take a medical history, get your family history, and figure out what kind of things we need to be concerned of or think about with your care. We can do a complete physical from head to toe, any kind of physical exam we are capable of doing. We're able to diagnose and treat lots of different illnesses or diseases. We're able to order and interpret test results, including labs, x-rays, MRIs, all those things. We also develop treatment plans for your healthcare. We counsel on preventative services, preventative care. PAs are also a first assist in surgeries, which is an interesting field that a lot of people are getting involved in. We can write prescriptions for medications. We can even write prescriptions for controlled substances. And a lot of physician assistants work in the hospital or the nursing home and can do rounds and treat patients and write orders in the hospital setting. What are the duties of a PA? Well, every job has its own set of duties, depending on where they work. Also, it's dependent on your level of expertise. Like I said, in our education, we sometimes learn some things on the job. And so if you've been working in primary care for 10 years, you probably will do more and know more than a new graduate in that field. Also, we can work in tons of different specialties, which will have different duties than you would in family medicine or pediatrics or in surgery. And then we do have to abide by state laws like every other healthcare provider. They only allow us to do certain things that we are accredited to do and licensed to do. Like I said, PAs can work in all different settings and specialties. Some of the examples I have here are we can work in hospitals, offices or clinics, rural and urban community health centers, nursing homes, the retail clinics that you might see in like a Walgreens or a Target has them. We can work in schools and universities along with industrial settings. A lot of big companies will hire some sort of a provider, whether it's a physician or a physician assistant or nurse practitioner, to manage their employees' health care and their occupational health care. I do know providers who work in correctional institutions and, of course, in the military, armed forces, and with the federal government. Here's a little pie graph showing where PAs tend to work. The largest majority is outpatient offices or clinics, and that also is the demand. The demand is highest in family medicine. It's a challenging field to be in. Usually we are overworked and sometimes underpaid. Along with hospitals is the next biggest group. Urgent care centers are becoming more and more popular for same-day or walk-in care. And then the 4.3% of others, and that includes, schools, universities, the nursing homes, the correctional facilities, things like that we discussed. here are some of the specific specialties that PAs work in. As you can see, primary care is a large portion of it, but as time goes on, it is becoming more and more specialized. So you can see even the largest specialty area is other, and other refers to psychiatry, hospice care, palliative care, OB/GYN, addiction medicine, pain management, public health, and dermatology, which are a lot of specialties that providers go into. And then, of course, we have a portion of PAs in internal medicine, emergency medicine, and pediatrics. So now you kind of know what a PA is, what we can do, which is vast. PAs are able to work in many situations and kind of learn and be able to increase their knowledge or change their specialty with on-the-job training. So now that you know what a PA is, you're like, man, that sounds like something I would like to be. I'm going to just talk through what some of the programs are like and what to expect. So the physician assistant programs are typically 24 to 26 months, and you tend to go throughout the entire year. So winter, fall, spring, summer. Typically, the requirements for the schools are the same as the medical schools. Most PA programs will expect about 3 years of experience or some sort of healthcare training. Some of the local programs, for example, Minnesota has Augsburg College, which is a private college for PAs. Bethel University, also private. St. Catherine's University, also private. And College of St. Scholastica, which is also private. South Dakota has one program, at the University of South Dakota. North Dakota has one program at the University of North Dakota. And St. Louis University. And I put that on there because that's the school that I went to. I was living in St. Louis at the time, and just like medical school, you get preference based on your residency. And at the time, I am from North Dakota. However, the UND program was meant for just registered nurses at the time. That has since changed, and I will show you that. So here's UND's program. I got this right off of their website, so this information is accessible and available to all of you with just a little searching on the internet. It is an accredited program. You never want to go to a not accredited program. The preference for local students is there, like I had said. It has dual tracks, or 2 different tracks. The first track will be from like no experience, starting right out of high school and going on. And the second track is you have held a healthcare career or job for quite some time, and then you're wanting to go back to school to become a physician assistant. So the pass rate at UND is 97 to 100%. The last number I have is from 2018, and the class graduated and passed their boards with 100% passing rate. The average class sizes are about 35 people, and the program length is about 24 months long. There's becoming more and more demand for PAs and PA programs, and it is becoming as difficult, or even sometimes more difficult, to get into a PA program than it is a medical school, just based on the percentage of applicants and the number of people that are accepted to the programs and the number of programs that are available. The minimum GPA is 3.0. The average GPA is 3.4 to 3.5, and becoming more and more competitive. The acceptance rate is 4 qualified applicants, with 1 of those 4 being admitted to a program. Back in my day, I had to fill out separate applications for every school that I went to, and some of them were on paper. Now all applications are done through a program called CASPA, and it's basically a centralized application site, and you load your information and then you pick which schools you would like it sent to. So in order to be deemed a qualified applicant. They're looking for some sort of medical license or certification, or like 1,000 hours of direct patient care experience. What they are looking for is knowledge of the medical field, passion for the medical field, and knowing that this is something that you have researched and are interested in order to pursue the career following the program. This is also on UND's website, and it's a busy slide, but basically it's just showing the layout of their program. So you'll have some on-campus time, some preceptor time where you're working with somebody, some specialty time, and things like that. The program usually begins in May of year 1 and ends in May of year 3. This is UND's requirements to get into the program. You typically have to have a 4-year bachelor's degree or a graduate degree of some sort through an accredited institution in the United States. Some of the prerequisite information is below. It basically tells you the minimum requirements that are accepted and the type of coursework that you would need to have completed. Basically, it's a science-heavy prerequisites along with the same types of classes that you would be expected to take for, say, medical school. So here's a list of some of the required coursework. Of course, human anatomy and physiology, microbiology, medical terminology, and statistics. And then they recommend some of these other courses such as genetics and pharmacology and biology, molecular and cellular, psychology, organic chemistry, and biochemistry. For the second phase that they have for PA school programs at UND, some of the requirements are slightly different. But that is something that you are able to search out on their website and make sure that you are meeting those requirements if you are interested in applying for school. And you can look those up for any school that is out there to make sure that you are meeting all the requirements for the schools you would tend to apply to. So what does the education for a PA look like? The coursework begins with basic sciences, anatomy, physiology, pharmacology, behavioral sciences, things that you would normally assume that you would be doing. Then it includes over 2,000 hours of clinical rotations. Some of the required rotations are family medicine and internal medicine. Internal medicine is basically adult family medicine, and they do have some more experience in a lot of chronic disease management. They're very similar, but internal medicine does not see children. You also get some rotations in OBGYN. There are PAs that can deliver babies. However, most PAs do work in the gynecology part of an OBGYN doctor or practice, excuse me. You do rotations in pediatrics, of course. General surgery. In general surgery, you get experience with being in surgery, scrubbing in, suturing, assisting with surgery if you're interested in that. But also, if you're not interested in working in surgery, you learn how to suture and things which you can do in a clinic setting also. Obviously, you get some experience in emergency medicine, which is very important, and psychiatry, which does deem a lot of our day in family medicine. We deal with a lot of mental health issues also. So you get into a great PA program, including the one at UND. You graduate from PA school and you're like, woohoo, now what? I need a paycheck. I've got tons of student loans backed up and I need to get a paycheck. Sometimes it can be frustrating after you complete school. You go through the whole program, you graduate from an accredited program, and you want to start working, but you have to pass the certification exam. So the certification exam is called the PANCE. which is the Physician Assistant National Certifying Exam. It is a challenging test. Like I said, most people pass it. Some people are not great test takers and they may not pass it the first round, but most people pass at some point, which is a credit to our programs and the accreditation process. Once you are completed with that, then you have to get licensed in the state that you wish to work. So you have to have a state license from whichever state you work with. I got licensed in North Dakota quite 4, 5, or 6 years ago, maybe now. And actually it's 8 years ago. And I had to get fingerprinted. I had to provide information for a background check. I, of course, had to provide my certification exam information and then was licensed to practice in the state of North Dakota. I've also held a license in Illinois where I used to work, and I do currently hold a Minnesota license also, but I do not practice in that state, but I am able to if necessary. You have to also do certain requirements to continue and meet your licensure every year, and those are updated mostly online, but do require some continuing education, which I will get to that. So now you're licensed, you're certified, and you start working somewhere, but you have to maintain your certification. So being a physician assistant with a -C behind your name means that you are certified to practice medicine. There are some, not a lot, of PAs who are not certified any longer, and they tend to work in research or something like that where they're not actually seeing and treating patients. As a physician assistant, we are required to complete a recertification test every 10 years. It used to be every 6 years, which I have done a couple times, and most recently has moved to every 10 years, which is amazing. And we have to complete 100 hours of continuing education every 2 years. Most jobs, including mine, will give you days of continuing education to be able to complete those hours, or go to a conference where you get lots of hours by going to talks throughout the day. So obviously 100 hours every 2 years is 50 hours a year, and I am given 40 hours of continuing education time. So some of that continuing education is done on my own time, but it's only 10 hours on my own time. And you are able to get continuing education by reading articles and things like that that you can do on your lunch hour or between patients if you have a no-show patient or things like that. So it's actually pretty easy to get the continuing education hours that are needed. And it makes sense. We are constantly learning, things are constantly changing, and so you're constantly needing to read and stay caught up on the newest and latest and greatest of medicine. So it's something that we do anyways. Average workday. So I have been a physician assistant for about 16 years now. I started in family practice, and I did that in Illinois for about 7 years. And then I moved back to North Dakota, and I worked in walk-in or urgent care for about 4 years. And now I'm back into family medicine again. I typically will get to work between 7:15 and 7:45. And when I get to work, I get into my computer and I go through and I result lab tests or x-rays or any sort of testing that I have ordered on my patients, MRIs, bone density tests, all those kind of things. And so I review the results and I send them a letter or a message or have my nurse call to give them the results and let them know what my recommendations are. I start seeing patients at 8:15, and I have a patient scheduled every 30 minutes. for the entire day from 8:15 till my last patient is scheduled at 4:15. So technically their appointment ends at 4:45. I do only have a 30-minute lunch, which is really not ideal, but it allows me to leave work 15 minutes before 5, which is important for me with my kids that are involved in after-school sports. So I'm able to make it to their games that start at 5 o'clock sometimes. When I am seeing patients throughout the day, I could see anything from a sick visit to a well child, to a checkup appointment on a 25-year-old. I do well woman exams. I do sports physicals. I do pre-operative exams, so you have to have a provider sign off that you are healthy enough to have the projected surgery that you are scheduled for. I can see anyone from 1 day old to 100 years old, and everything in between. So my day can be pretty interesting. It can also be very, very crazy and hectic, but with the help of my nurses and staff, we usually get through most days without too much trouble. So this is probably my favorite slide of the entire presentation, honestly. People that are interested in becoming a healthcare provider of some sort, whether it be a physician, a nurse practitioner, a PA, or even a nurse or x-ray tech or lab tech or anything like that. Kind of some of the things we want to know is, how much schooling is it going to take me? What am I going to make when I'm done? Is there a lot of jobs out there for me, or am I going to have difficulty finding a job? So this kind of summarizes it for PAs. The median age for a physician assistant is about 38 years old. I am now above the median age, unfortunately. But the majority of PAs are in the 30 to 39 years age range. And that's because a lot of PAs, it will be their second career sometimes. It's becoming more and more popular to be the primary career choice. It was my primary career choice at the time. So I think that average age is going to get younger as more people get into the program at a younger age. Unlike the physician programs, the medical doctorate degrees, PA programs are 67% female and 33% male. I honestly don't know exactly why that is. However, I do know that there are a lot of women like myself who chose to do the physician assistant program instead of the medical school program, because I know how grueling medical school can be and how much time is necessary to get through residency. And a lot of physicians will be owners of their own practice and things like that. And I was most interested in having an amazing career and getting paid well for what I do, but also being able to have a home life and raise my children. And so I think that's a lot of why a lot of women go into the PA program, because we're able to do a lot of what physicians do, nearly everything of what physicians do, but with less like legal ease and commitment to 16 years of school, basically. Most PAs will see about 15 patients per day, which then they will see about 60 patients per week. And that is about exactly what I see. Average years of a PA is 8.5 years. That's obviously, people love their jobs. Typically, I follow a lot of message boards that talk about how happy PAs are with their jobs and things like that. So it's very positive. We saw before that primary care is the largest specialty. And then this is kind of one of the most exciting portions, is the compensation. I believe that North Dakota is right around the median salary of about $93,800 per year as a starting salary, which is really great for what we do. And then this last little box here shows that most people are employed in a clinic or usually a hospital setting. And then this is the other great box right here. Satisfaction, job satisfaction. PAs who would choose their career over again as a PA is 84.1%. So very high satisfaction with their job and their career course. Job outlook. So like I said before, PAs are in heavy demand. Like I said, 3/4 of PAs have multiple job offers when they are completed with school. The demand is only increasing, and studies are showing that hospital systems do much better when they do have PAs on board. We cost less than physicians, but we also are able to bring in the same amount of financial benefit for the hospital system. Sometimes all of this stuff can be kind of boring, except for that we make good money and we like our job and things are kind of cool. I do have a couple interesting cases that I'd just like to tell you about and show the kind of impact that we can make on patients. I was working in the walk-in. I had a young man come in. He was in his early to mid-20s, and he had pink eye or conjunctivitis. That's all he was there for. He says, I know I have pink eye. I just need some eye drops so I can go back to work because I think I'm contagious. And I always listen to heart and lungs. I never see a patient without listening to their heart and to their lungs. And I did that with this patient. And I heard a heart murmur. The gentleman told me he had never been diagnosed with a heart murmur before. He had gone and played sports in high school and college, and nobody had said that before. He wasn't having any symptoms that would make me think that he should have a heart murmur. But because of that, I got him set up for a echo, which is a test of the heart, and to see a cardiologist. And he had an abnormality of one of his heart valves, and he did have to have open heart surgery, but he claims that I saved his life. He would have had symptoms eventually and probably would have been seen. He would have had some shortness of breath and trouble with exercise and things like that. But obviously we can make a giant impact on patients as long as we are thorough in doing our jobs. Lacerations, sewing or stitching lacerations is always a fun thing to do. We will see patients with chest pain and shortness of breath, and we'll see patients with a mole that they're worried about. We also do see in the walk-in and primary care acute abdomens or appendicitis. And so we're able to diagnose that typically in the office and send them for additional testing and a surgical consult. So kind of see a little bit of everything, and pretty interesting job most of the time. I know you guys are going to learn about all these things, and you probably already have, but my main tool is my stethoscope. We also use an otoscope or ophthalmoscope. This is an otoscope. You can change the head on it to be an ophthalmoscope, which is what you look in people's eyes with. A blood pressure cuff is probably the next most important thing. And then these are some tools that we will use for lesion removals or suturing or things like that. And then that's an old generic thermometer that we don't use anymore. We'll use a different type of thermometer. So what can you do to prepare for wanting to go to physician assistant school? Take as many science courses as you can in high school. do your best to find somewhere to volunteer, whether it's in the hospital or a nursing home or a clinic, even if it is just doing some sort of paperwork. It gets you into the setting, hearing people talk about medicine and different things, and just exposing you to how a medical facility runs. Obviously, with COVID-19 and the pandemic, it's more and more difficult to be in those kind of settings right now. But keep searching them out and getting as much experience as you can. I mentioned this before, but research, and research the programs that you could be interested in, the requirements that they have, and making sure that you know what you need to have completed to be able to even apply for that program. Talk to family, talk to friends. Anybody in the medical profession can give you some guidance or help or knowledge about medicine, and they maybe know somewhere that you can volunteer at or work or things like that. Probably my most important recommendation is to become a certified nurse, if you can, a certified nurse assistant or another type of medical profession, and work in that setting. It's not always the most glorious work that you'll do, but it is huge and makes a difference in patients' lives. And it really gives you the basis or the groundwork for going into any sort of other healthcare profession. This is a clip from Essentia's website. I did this last year in 2019. I have not looked at it since. I'm guessing it's changed right now, or we are not taking volunteers until the COVID pandemic is controlled. But these are things that we typically have available for volunteering opportunities. The information is on that website to apply or to call, or like it says that we do have some unique opportunities for youth because typically you need to be 18 years old to volunteer. But contact our volunteer department. They are able and willing to help you and find something that will work for you. I hope you find it helpful, and if you have any questions or concerns or anything that you want more information on, please speak to your teacher, and if they don't have an answer for you, they can always get a hold of me and let me know, and I can see what I can do to help. It's a great profession, and if you're interested in it, you will do great things. And it is a career that you can be proud of and do for the rest of your life. Thank you for being such good listeners. And if you need anything else, please let me know.